there! Welcome back to our channel. Today, we're diving deep into one of the most talked about diseases out there, Lyme disease. You've probably heard a lot about it, but how much of that information is actually true? In this video, we're busting some common myths and uncovering the real facts about Lyme disease. Stick around because we're separating truth from fiction, one tick at a time. Have you ever been told you can only get Lyme disease from a deer tick? Or maybe you've heard that Lyme disease can't be cured. Well, buckle up because we're about to set the record straight. Alright, let's start with a big one. Myth number 1. You can only get Lyme disease from deer ticks. While it's true that deer ticks are the most common carriers of Lyme disease, they're not the only ones. Other ticks, like the black-legged tick, can also transmit the disease. However, deer ticks are the primary culprits in most cases. But not every tick bite leads to Lyme disease. In fact, only a small percentage of ticks carry the Borrelia burgdorferi bacteria that causes Lyme. Now, here's a dangerous myth. If you don't see the bullseye rash, you're in the clear. False. While the bullseye rash is a common sign of Lyme disease, it doesn't appear in all cases. In fact, about 20 to 30% of people with Lyme never get the rash. Other early symptoms like fever, fatigue, and joint pain might show up before any rash does. That's why it's important to pay attention to how your body feels after a tick bite, even if you don't see any marks on your skin. Now this one's scary, and fortunately it's not true. Myth number 3. Lyme disease is incurable. Hold up! While Lyme disease can become serious if left untreated, it's not a lifelong sentence. With proper antibiotics, most people recover fully. In fact, early treatment within the first few weeks of infection usually leads to complete recovery. But here's the catch. If it's not treated early, Lyme can cause long-term issues like arthritis, nerve problems, and heart complications. So, the key is early diagnosis and treatment. Now let's talk prevention. Myth number 4. You can only get Lyme disease in the summer. While it's true that ticks are most active in the warmer months, they can actually bite at any time of the year, even in fall or spring. Ticks don't disappear when the temperature drops, they just become less active. So if you're planning to be outdoors, always take precautions like using tick repellent, wearing long sleeves, and doing a tick check when you get back inside, no matter the season. Finally, how accurate are Lyme disease tests? Is it possible to get a false negative? Let's clear up the confusion in our final myth. Here's a tricky one. Myth number 5. Lyme disease testing is always accurate. Unfortunately, that's not the case. Blood tests for Lyme disease aren't perfect, especially in the early stages of infection when antibodies may not have developed yet. It can take weeks for these antibodies to show up in a blood test. That's why doctors often diagnose Lyme disease based on symptoms and history of tick exposure, even if the test comes back negative. In some cases, follow-up tests are necessary to confirm the diagnosis. So what's the bottom line? Lyme disease is serious, but it's also preventable and treatable. Knowing the facts can help you stay safe and avoid unnecessary panic. Now that we've busted these myths, you're ready to enjoy the great outdoors with confidence. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to hit that subscribe button. Stay tuned for more health tips and myth-busting videos right here. And if you've got any questions or want to share your Lyme disease experience, drop a comment below. We'd love to hear from you.